The mnemonic of the day is AEIOU-TIPS, which introduces us to the causes of altered mental status or AMS. AEIOU-TIPS is a mnemonic acronym used by some medical professionals to recall the possible causes for altered mental status. Medical literature discusses its utility in determining differential diagnoses in various special populations presenting with altered mental status, including infants, children, adolescents, and the elderly. The mnemonic also frequently appears in textbooks and reference books regarding emergency medicine in a variety of settings, from the emergency department and standard emergency medical services to wilderness medicine. A stands for 1. Alcohol. 2. Abuse of substances. Examples of which include alcohol or drug intoxication. And 3. Acidosis. Like diabetic ketoacidosis, respiratory acidosis occurring due to CO2 narcosis, and hypoventilation due to COPD, asthmatic airway obstruction, or neuromuscular disease. E stands for 1. Ecstasy. 2. Environmental causes. Examples of which include hypothermia and hyperthermia. 3. Epilepsy, which includes an epileptic seizure, or seizure for any other reason. 4. Electrolyte disturbances, like hyponatremia, hypernatremia, hypocalcemia, and hypercalcemia. 5. Encephalopathy, including Wernicke's encephalopathy and chronic traumatic encephalopathy, CTE. And 6. Endocrine diseases, like adrenal insufficiency and thyroid disease. I stands for infection, and the examples include encephalitis, meningitis, meningoencephalitis, and sepsis. O stands for 1. Overdose, as in prescription or non-prescription drug overdose. And 2. Oxygen deficiency, examples of which include hypoxia due to pulmonary edema, pulmonary embolism or tension pneumothorax, as well as hypoxic brain injury due to cardiac arrest. The U stands for 1. Underdose, like when insufficient dose of prescription medications is taken. And 2. Uremia, which indicates presence of excess urea in the blood due to kidney failure, congestive heart failure, or urinary obstruction. Now, T is for 1. Trauma, which includes concussion, traumatic brain injury, or increased intracranial pressure due to epidural hemorrhage. And 2. Tumors, like brain tumors, metastasis to the brain, and paraneoplastic syndrome. This I stands for insulin, as in hypoglycemia, and hyperosmolar hyperglycemic state, and intestinal problems, like intussusception, or intestinal malrotation with volvulus. P stands for 1. Psychogenic disorders, like psychosis, pseudo-seizures, or conversion disorder. And 2. Poisons, like carbon monoxide poisoning, lead poisoning, and iron poisoning. And finally, S stands for 1. Strokes, an example of which is a hemorrhagic stroke due to arteriovenous malformation, AVM. 2. Shock, like neurogenic shock occurring due to spinal cord injury, or cardiogenic shock occurring due to myocardial infarction. This is the end of the video. Check all kinds of medical mnemonics in this ongoing series. You can find the videos in the cards.